as emergency managers and public safety officials, our job is to be thinking about the next thing that's coming at us and to keep that view, that focus on all of these interconnected risks that we experience, and to divide our time amongst those accordingly, and also then to understand how they all start to play amongst each other. And so for us today, let's take a look at, I want to share a few key steps that I think will help us understand this interconnected nature of risk, to understand how we get ready for the next crisis with pandemic continuing around us. And that's the opportunity in front of us. So I just want to pause and say that I know that this is different, right? I know that what you're doing today is different than you ever probably thought it would be. For me in emergency management and working at government level at the state, going into nonprofit now at Esri now for many years, I never thought that we would be in a complete 100% virtual operating environment, working to support crisis response in real time. I never thought that we would have to figure out ways to mobilize teams around incidents globally at a scale of a pandemic like we did, more than those 5,300 organizations that reached out. Sense of scale for us, a busy year on record for Esri and the disaster response program would have been around 500 requests a year. So now you see where we are at 5,300. So we are trying to figure out how to work at a scale and cadence that is different than ever before. A timeline that is much more extended around this crisis than ever before, and on top of that, virtualized. And so that's forcing us to do a number of things as a community. That is, that I think it is forcing some of the changes around us to adopt technology that allow us to do things like today with this virtual webinar, to mobilize teams in a sense. And it's a way for us now in this moment to seize that opportunity and the forcing function that COVID-19 has put on many of us, whether you're in government, you're a business, or you're a volunteer in the community that's working to support, search and rescue, or whatever your role is, to evolve the way that we think about our procedures and transform some of these processes that may have been lagging. And now, because of COVID-19, the virtualization, the scale, the pace at which we are having to sustain is forcing us to find new ways to evolve. And I think that's how we build resilience. So I want to share with you what I think are 4 steps that help us do that. The first is that with COVID-19, one of the things that came out of this was that we have to be better at anticipating emerging risk, to understand how we address vulnerabilities more directly in an equitable way, not in a just blanket way, if you will, within a community that you serve. And one way that we do that, and the value of geographic thinking, is through spatial data, understanding exactly where the vulnerabilities lie, understanding where the emerging risk is starting to persist. And using these technologies, we can start to use both the science of the pandemic, the epidemiology, if you will, in the case of COVID-19, with your science of emergency management and geographic thinking combined to really start to pinpoint and understand where we can take action in advance to get in front of whatever threat may be coming, a forecast for a flood, a forecast for a wildland fire, the trends that help us anticipate more. COVID-19 gave us a great example of this. On the screen, you'll see a GIS approach to looking at medical surge needs. So if you think about it for a minute from an epidemiology perspective, there are scientists that work on rate curves and understanding these projections of when hospital bed capacity or when PPE would be exceeded. But putting it in the context of geography allows emergency managers, the planners, to say, more than just we know the rate curve is exceeded with a certain number, we can actually determine where that number is exceeded. So specifically, this area of the community, this hospital in the case of the pandemic. That's the value of shifting our thinking, relying on spatial data and the science of geography to help us anticipate more than just saying there's a number out there and the forecast tells us that a hurricane is coming or a flood, but specifically, what does that mean for us in the context of the people we serve, the infrastructure we're protecting? And if we do that and we start to understand exactly where the need is greatest, to anticipate where we should be looking in advance for resourcing and mobilizing mutual aid and the like, we can then take GIS to the next step, which is doing a location allocation. It's the ability to take all of those needs in the context of geography, all the people that we are trying to serve, overlaid with the risk that we now understand, more targeted risk that we understand, and start to determine where we put points of distribution for resourcing the pandemic, to do vaccinations that are coming in the next year. How do we do that more in a spatial context of a map? That's the value of shifting to geographic thinking. And by way of just showing how this is being done here in my own country here in the United States, we look at the U.S. Army Corps of Engineers working with Northern Command, NORTHCOM, who are doing this exact process where they are using the rate curves and epidemiologists to define the science that they are good at and combining the emergency management things that we are good at together to say this is where we should be targeting medical surge capacity. That's people and doctors to help offset. It's also where we put beds and medical supplies and potentially build out temporary hospitals when needed most. It's a great example of an organization that's taking geographic science and thinking to better anticipate where they mobilize resources in partnership with the locals that they are there to serve. Now, the second part that I want to kind of convey is that if we do all of that, if we start to leverage the science and look at, again, with a COVID lens for a minute, that's really complex science. I would say that there are probably a few epidemiologists on the call today. I'm not, right? And certainly inside of Esri, leading our disaster response program, I've had to lean very heavily on my colleagues in our health sector who are epidemiologists, who understand progression and rate spread of a virus. But all of that science and all of that data, no matter what incident or what hazard we're focused on, can be complex, both for our decision makers and elected officials, but also for the communities that we're trying to convey that message to. When to take action, when do you need to evacuate in advance, or do you understand what your zone is beforehand? So how do we understand this information and make critical decisions? Well, one great example, again, just to kind of start again at COVID-19, I would say is the Johns Hopkins University. This is the Center for Systems Science and Engineering, who I would say arguably has created the dashboard seen around the world, literally making billions of maps a day at the peak. This application brought together data from disparate sources. It put it together into a dashboard that allow local folks, my family, your family, as well as decision makers to really start to discern exactly on the map where there's opportunity to move forward. And there are tremendous examples of dashboards rising up to simplify the understanding of some very complex science and data, where the rate curves are progressing, how the map is changing in relation to that, where are we doing about it in real time? I know those measures that we are putting into place, those planning assumptions we're working against, are they actually making a difference in the operational side of the house? A good example, just coming into Canada for a minute, I would say, is looking here at British Columbia. This dashboard broken down by different sectors inside of that, looking in British Columbia, looking at Fraser, Vancouver Coastal, or Vancouver Island, is a great way to start to allow people geographically to think about their own backyard, their own home. And then by sliding some of the widgets, we can actually see exactly what's happening against cases reported day over day. That's a lot of data, and that's a lot of information that can be very complex. But by using dashboards, we can start to pull widgets and frameworks down. So understanding the decisions that need to be made allows us to communicate much more effectively in crisis moments. Another good example, I would say, that just takes it to the next level, if I kind of go around the world for a minute and take a look overseas in Australia, this is New South Wales. I love this dashboard and I want to share it for a specific reason. And that is that the map and the widgets look very much like you would see for any other dashboard. A lot of data, a lot of information. But what happens when a decision maker says, well, what about this scenario? What I love about New South Wales is they've done this little widget on the side. So I can literally slide and I can look at socioeconomic disadvantaged populations. I can look at populations at risk, so over certain age characteristics like over 60, over 65, or under 65. That changes the widgets, that changes the map. So literally, as we start to immerse ourselves as decision makers for emergency management into the data, these dashboards allow us to quickly discern patterns. They allow us to ask questions around different scenarios, planning assumptions that we need to adjust our thinking in real time. I love what they've done here in this example of connecting. Now, we've learned about the science, we've talked about how we communicate, but what about what comes next, the thing that's coming at us? So in the midst of all of the pandemic, we know that the other hazards that we have to focus on don't stop, that the forecasts that are coming in right now for us in the US, the wildfires out west, the hurricane that we're watching down in Central America that's moving back up, those things continue around us. And so we have to, as emergency managers, be able to not only do the things we do for each incident, but then start to plan against all those other factors that are out there and then adjust our course quickly to gain the advantage. Two examples of why I think geographic thinking, GIS, makes a difference in this case. If you look back in March of 2020 of this year, the Zagreb earthquake occurred at the peak of the pandemic. The data on the left side allowed decision makers to literally move through the community and look at building structural damage without having to be exposed in the community. On the right-hand side, that data is actually being collected by the first responder community in the top right. These are structural engineers who are out there with PPE equipment, using mobile devices in the field, feeding a dashboard in the bottom right that shows structure by structure what the damage is. Now, this could be a wildland fire, this could be a flood, this could be a hurricane, an impact from an earthquake, just like we saw in Zagreb. The beauty of this is they're using the same tools that they're using in the midst of the pandemic. The dashboard you see on the right is the same dashboard that we see Johns Hopkins using, just configured now to show damage assessment and to show the categorization of damage. If you look then just a little bit farther into the year, August of 2020, the Beirut port blast. Same kind of concept here in the fact that in the bottom side, we see post-event imagery coming in that allows decision makers to navigate the community without being out and exposed, to understand visually where they need to be focusing their efforts for search and rescue, for extraction, for the building back of the community. On the top right side, you see some of the search and rescue teams that were deployed out using mobile devices like you see on the right to collect information about triaging work sites that are out there or doing surveys directly in the field, again, feeding a dashboard back in. So in the midst of a pandemic, we've seen how organizations can take the same tools that we're leveraging and seeing value in. So I would say the lesson for us is to look inside of our own organizations and understand where we're having success in the way that we're communicating with maps and dashboards, and carry those forwards into the next event so we're ready to move in. Now, the one thing also that this shows, and I think Beirut is a great touch point for this, is that with the pandemic, with these cascading consequences across all their hazards, when those things occur, we know that we need partners. We know that we have to be able to collaborate and communicate across boundaries. I love between us, as I talk from the US and you're in Canada today, I love some of the dialogue that I saw earlier this year about the wildland fires out west. And the questions being like, obviously the data must stop. There's no wildland fires in Canada because a map that somebody was looking at had a boundary with just maps in the US, separate map for British Columbia and the like. We know as emergency management, as professionals, that disasters and crises know no boundaries. They don't see and recognize the boundaries that we do. That we have to be able to communicate and work together as partners to combine our efforts and engage in these interconnected communities, just like crises demand. So by way of showing you how this works in the case of a crisis, and specifically looking at wildland fire for a minute, I want to look at the Federal Emergency Management Agency here in the US, just an example. So they were using this hub technology, a way to collaborate and connect people together, if you will, into an environment that allows information sharing around lifelines for security and medical aid and food and water related to the pandemic. But the wildfires out west picked up at the peak of the season. So they were able to pivot quickly, the same technology that was working to collaborate across the environment for state and local and federal agencies to build the same kind of environment for wildland fire. So you see the application on the screen. This is an application that's pulling in data sources from federal agencies, from local agencies, from US Forest Service for the fire perimeters. All of that data being aggregated and collaborated with in this mapping environment that provides kind of a sense of normalcy that we can look across boundaries, you can look across jurisdictions. So just to drive the point home here a bit more, if we zoom down and look at one of the largest fires in California history, this is the LNU complex fire. This is a fire that occurred up in Northern California. And what we're looking at is the state's damage assessment. So if we zoom in, you'll actually get all the way down to the actual structure where firefighters on the ground are using mobile devices, just like we saw in Beirut and otherwise, to capture structural information, to document that damage to the structure, to populate the dashboard for CAL FIRE that's then being surfaced and shared inside of the national collaboration hub for others to access and pick up and use for their specific purposes. I love this example, really going from a building on the ground all the way up to a national level collaboration, because we know, again, it takes all of us to do that. And I think that just exemplifies one of the quick points. Now, I've talked a lot about authoritative data and collaboration. One of the other things that we're seeing coming out of COVID-19 and the wildfire season, again, just to continue that thread for a minute, shows this greatly, is that the community writ large, all of us who are at home and maybe looking at ways to contribute and wanting to contribute in some way to the problem, have found ways to do that. And in the wildfire community, engaging them together to detect early starts of wildland fire is one of the key examples I would say that we're seeing. So the fire mappers community got together, they looked at the authoritative data sources like I just shared with you, and they see where the formal perimeters are coming in, where the satellites are passing over, showing hotspots of those fires on a daily basis, and where those actual resources are being mobilized and put into the context of a map, the data points on a map that say this is where the fire started and progressed. But before it gets to that point, what happens? Well, there's certainly chatter in the community. The media is picking up that there's smoke on the horizon in Southern California. Social media starts to pick up and starts chatting about that. And so as a citizen or a resident, you're trying to understand what that means for you in the context of a location. So the fire mappers community actually came together and realized that they can help with this immediacy of plotting the location on a map for situational awareness. So there's a new fire, let's locate it based on what we see from the scanners and from the radio and what the chatter in the community is. They validate that against a bunch of different sources to say we think we're in the right vicinity. Then they share that location on a map with other contexts, linking to these authoritative sources from federal agencies and national agencies, as well as state. And then over time, as that official perimeter shows up and the data point comes in from the US Forest Service, their point falls away and that becomes now the authoritative map. They're not intending to take over the authoritative map. They're intending to contribute as a collaborator in this need to better understand the immediacy, the start of a wildland fire. This is a great collaboration between the NABCIG Foundation, Cedar Digital Core, and GIS Core from ERISA. I think it's a good model that will persist on, and we've seen this in COVID-19 with communities contributing to things like what are my local commodities and status of shelving and the like. So having said all of that, those key opportunities in front of us, I would say that where I want to go next is to say that we have an opportunity again. Now is the time to apply those lessons for the next crisis response. Now, inside of Esri, we take this disaster response program extremely seriously. We follow incident command system. We scale up and scale down. We scale horizontally, just like you would as an organization. We also look at after action to understand what patterns are emerging in the community. We talk to a lot of our users like yourselves to understand where we need to build better technology and just generally what's happening in the community at large around lessons learned so that we also evolve our thinking and move forward. These key milestones, I mentioned the North Korea earthquake is 94 is the first, all the way to where we are today in 2020, has taught us a tremendous amount of lessons. If we go back and look at history against the 26-year plus history of the program now, and we mine all of our after actions and all the data where we've offered assistance, we come up with 6 main things that people repeatedly ask for. And I would say if people keep asking us to help in these ways, to provide maps and location intelligence around these patterns, they are an opportunity for us to all pause for a minute and to assess, do we have the baseline capabilities to do these 6 things? Do we understand the potential impact? Do we understand where we need resources? Do we understand what the capacity of those resources might be and where do we position them? Are we monitoring all the changing conditions in the forecast in real time? Do we have ability to mobilize teams in the field and gather an intelligence back that helps us change the assumptions of what we see real time on the ground? And then how do we brief our partners and how do we then communicate with the public and the media who are asking for that critical information? You know, these 6 things I think are not that dissimilar from what I just shared in kind of a storytelling form. It's the same things that COVID-19 is just exacerbating and telling us. And so as a company, we spend, again, a lot of time trying to understand how we help organizations build resilience, to understand how to configure tools and what can we provide as starting points for people to move forward. And we spent time around those 6 areas to group them into 3 logical areas. One is like, how do we maintain situational awareness? How do we conduct damage assessments and understand impact? And how do we manage the flow of public information? And we made freely available tools so that people who leverage ArcGIS can download that tool for free. They can put their logo and configure it and not have to start from scratch, right? We want you and as an organization, all of us, to have a baseline of readiness so that we can be more agile and responsive in the way that we move forward. And those patterns, as I just shared with you from COVID-19 and some of the other fires and stuff that we're looking at today, continue to be validated. And I would say that this is the foundation in front of us. If we can do these 6 things, and I would say that's an assessment for you as an organization. If you can check that list and say, we have a tool that works for that, that's great. Are we training against it? Are we modeling against it? Are we institutionalizing that tool? That's amazing. If not, there's an opportunity. And how do you move forward? It may be through Esri, it may be through another function. But know that these patterns of use, I think, are what I want you to take away. So that's a lot about response, right? Response in the moment is what we all get thrust into. It's what the media, is what all of our friends and family are paying attention to when they finally figure out what you as an emergency manager do for a living. But beyond response, I think, is where we also have the opportunity. So as a program, we've also looked around the life cycle of emergency management. Not just at response, but if we look at recovery for a minute, the ability to assess the impacts, you know, the damage assessment process kind of crossing between those 2 but also looking at managing debris removal, understanding what's in the community that's blocking transportation routes. How do we restore some of the lifelines for communication and the like to a community, and restore services back into that community, and monitor the progress and communicate that both with the residents in that area, but also with government officials and the media who are asking for that information, understanding where money's being assigned and how those grants are being distributed and how resources are available for residents to sign up and access. And if you go around to mitigation, looking at opportunities for GIS and for mapping, certainly this is a point where we can step back and start to evolve our thinking and look at all those lessons learned. We can start to assess this integrated nature of the risk that we face, to really map the threats and the hazards in relation to the demographics, the racial inequities, the social inequities that exist in communities, access to transportation and healthcare, all of those factors that come together that help us as emergency managers design effective programs and mitigation strategies to reduce risk, and also to understand how we actually move forward and create an environment with which a hazard doesn't have to turn into a disaster. These tools are perfect for GIS to layer them together in the context of geography, and then to communicate, right? To get input from that community of how they see their own community. Where are they seeing opportunities for us as a community writ large to actually come together and devise strategies around that? And so if you communicate, we plan these strategies, we finally get to the preparedness aspect, which is now we can actually work together to communicate and use these programs to increase community resilience, to train and exercise our own teams, our community volunteers, our partner agencies on these processes that allow us to move forward. It's also a time where we can actually use GIS and mapping to really run exercises that are much more realistic. We can use them to scenario base what happens if a tornado comes through an area, who and what might be impacted, more than just putting injects to an exercise that are made up. And I think all of us have been in those exercises before. We can actually say, if this were to happen, this many people, this many pieces of our infrastructure, this is what happens to the transportation network. What do we do about it? And I would say that's a great opportunity in the preparedness phase to leverage location intelligence. It's also a time when I would just argue that we have to be looking at our technology systems to harden those, just like we harden our procedures and the methodologies, the plans that we have, include technology in those plans to make sure that if your map or website goes viral in the midst of a pandemic, pun intended, that you actually can stand up to the load, so that if Johns Hopkins dashboard goes to 1 billion maps a day, how do you do the same, right? There are lessons that can be shared and best practices to do that. And then we get into the cadence of maintaining situational awareness to get into that anticipation. And so to summarize all of that and where we lead off today is that I would encourage all of you to take this opportunity in front of us that COVID-19 has forced upon us, to embrace the transformation that's around us, just like you are having to do in your daily lives, to mobilize your team around a Zoom meeting, to mobilize your organization in different ways. But how do we do that? How do we evolve our thinking based on the lessons that we learned from crises? Find what works, let's move it forward. Find what didn't work, let's adjust around that. Hopefully what I've shared with you around some of our lessons learned today actually help you understand maybe the baseline of readiness, a checkbox, if you will, that allows you to do a self-assessment. As we look to mitigation, think about how GIS and science allows you to look for this integrated risk, to understand what that means in the context of your geography that you support, and then prioritize your projects and mitigation strategies to target those vulnerabilities in a much more equitable way. That's resource management right at a core, and money management to deliver impact that can help make a difference. And then prepare and test your systems, your staff, and your processes repeatedly, and then engage your community at large to be part of this whole process and communicate with them bidirectionally. We've seen people want to contribute. They're going to expect that level of contribution, that level of engagement moving forward beyond COVID-19 to other hazards. So we have to be ready to enable them. And I think if we do this and we think this way, we evolve our thinking, we are better able to manage and respond to any threat, to any hazard that comes our direction, and build resilience that we need inside of our own organizations and in the communities that we serve.